everyone. Welcome to the Holistic Birth Podcast, where we put the power in families' hands to have the safe, satisfying journey they deserve. My name is Allison.
And I'm Brigitte. We are two doulas who love bringing information along with inspiration to help you feel confident and powerful in your choices throughout the birthing year.
We cover all topics around pregnancy, birth, and beyond. We're so glad you're here.
Let's dive into this week's episode.
Welcome back to the Holistic Birth Podcast. This is episode 12, and today we're talking about tokophobia, which is the fear of birth. Our job today is to help you with some understanding around it and to help you establish some tools to potentially overcome it if you are currently pregnant or if you're kind of starting to explore the thought of starting a family.
Yeah. Because tokophobia is not something it's fun to deal with, so we definitely want to give you the resources and everything you need to get through and start a family if you want to. So, yeah. So tokophobia is a psychological condition characterized by an intense fear and anxiety related to pregnancy, childbirth, or the prospect of becoming a parent. The term tokophobia is derived from the Greek word tokos, meaning childbirth, and phobia meaning fear of. Individuals with tokophobia often experience overwhelming anxiety, panic attacks, or even avoidance behaviors when exposed to situations or discussions associated with pregnancy or childbirth. Research conducted in various countries has reported prevalence rates ranging from 2 to 14% amongst women.
That's more than I thought.
Definitely more than I thought, too. Yeah.
I've had a few clients who struggled with tokophobia, but it's
yeah.
I know we only see a small population, but it's I think fear is very easily running rampant. It's very hard to understand and then know what to do with. So there's, and I think with fear, usually when it comes to tokophobia and around birth, usually there's specific components that feel like that's sparking the fear. So a lot of times it could be pain, it could be like the idea of any medical procedures or complications. We all tend to like control, and there can be a loss of potential of control throughout the birth process. Some people feel that it may impact like the health of their body, or worry about like outcomes or the oneness of baby. And sometimes it can be rooted in something that was kind of rooted or planted in your childhood, and other times it's something that's like a secondary version of tokophobia where you've had a previously traumatic birth experience that's now informing these thought processes and fears.
That's definitely a lot to unpack there. So
Yes.
So another thing that could be is like cellular memory or past generational experiences, which is a little woo-woo, but definitely something that, I look into with, clients. They're dealing with fears in general or, this in particular. And it can be just like stored in the body and not even really realizing it. So, talking to your, mom or whatever about her experience. We'll get more into this in a future episode, but I just wanted to bring it up because I do think it can be, probably something that's involved in this kind of fear.
It's very relevant. It's very relevant. And it's hard because you could definitely get very woo-woo with it and think about the energetic components of these things or how it is being stored or passed through the body. The Body Keeps Score comes to mind as a book.
Yeah, definitely. It's a good book. Yeah.
Kind of sounds kind of related in my mind in a way. But yeah, we do store, I think, a lot in our bodies, and obviously with some of the physical symptoms and expressions of this fear, it's interesting to try to uncover where it's coming from and all of that.
Yeah, and it definitely significantly impacts a lot of people's quality of life, and it may lead to difficulties, expanding your family. It can cause distress and strain on relationships with partners or family members. If it goes untreated, it can also contribute to mental health issues such as depression or anxiety disorders. So it does create like a lot of, anxiety. I feel like that's really kind of the core of it, is just creating so much anxiety. And if you want to have children and you have like this fear hanging over you, it can be just like this very heavy weight that's kind of weighing you down and not fun to deal with. So
No. Not at all. So if you're feeling like any of this is resonating, no, you're not alone.
No, exactly.
Yeah, you're not alone.
Yes.
Yeah. So I guess it would be great for us to try to help give some hope of potential ways to overcome some of these things. They might not all just poof away, but it's helpful to really help shrink it a little bit, or find ways
take the edge off a little bit.
Take the edge off, exactly. Or find ways to work with it, or have it be still, maybe it's still part of you or in you somehow, but it's not driving every deciding factor or every possible scenario. But ways to overcome would be a great next place to start.
Yeah, definitely.
Everybody copes differently with anxiety or fears, or just in their life there might be things that are like a heavier hitter option than others. So this is just merely a list of ideas and things that we've seen that have potentially helped people with reducing fear, that feel free to take what you want from the list.
Yeah, definitely. Yeah. Whatever works for you, for sure.
Yeah. Yeah. So the first thing that comes to mind is journaling. It can be really great to get some of these feelings out on paper. You don't have to share it with anyone, or you could if you feel like that's helpful for your doula, your partner, a friend or therapist or something. But really making time to take a peek at what's below the surface can really be helpful with understanding it and kind of identifying those feelings, identifying where it's showing up in your body, how it's shifting throughout the day, and know that you're validated at probably everything you're writing down.
Yeah, validating yourself is really important. So,
And it's definitely a way that you can somehow take it out of your body or your mind and put it somewhere else. And there are, like fear releasing rituals that also could be done with this. You could write it all out and then burn that down safely. Yeah. But you could just like burn the piece of paper or whatever it is. But there's also EFT tapping, which we should definitely do a whole we could totally do a whole episode or something on
that'd be
tapping.
A great idea.
That would be great. But essentially it's like focusing on certain like energetic points throughout the body where you're specifically tapping those points, and helps with re-regulating and does help you with some sort of sense of control, helps to ease anxiety. Anything to add on?
Tapping? It's really just like a general like nervous system relaxation technique. So it really just helps you calm your nervous system. And you can listen to music while you're doing it. There's a great app you can download. It's the oh my gosh, what's the name of it again? I think it's the tapping solution. I think that's what it's called. So. Yeah. But there's actually tons of like free ones on YouTube you can look up, and it's a really simple thing. You can remember the points. They're really easy. Just like whenever you're getting triggered by something or just feeling overwhelmed, just starting to tap will just kind of regulate your nervous system. Yeah.
And I think there's a local woman to us, and she is an EFT practitioner, and she had talked about, she did like an education opportunity for our doula team, and she was explaining that there are even just the thought of tapping or like imagining that you're doing it does also help, like at least a little bit still. So even if you're not in a place to do it, like sometimes it's a little weird when you're like out and about to be like tapping different points. There's like I think one of the things I took away from that training was even just like using your thumb to tap on the different points on your fingers. That's so discreet. So you can really take some of these tools and apply them anywhere.
Definitely.
There's also support groups. Sometimes it's hard to talk to some of the people in your life about birth and the fears and tokophobia. So support groups can be really impactful as well, because not only are you getting it out there, but you're also feeling validation, or you're kind of witnessing what other people have done, or you're kind of hearing what they're sharing maybe worked for them. So you kind of just get this continuous like idea list of inspiration of things that you could try, or maybe you can have something that would be helpful to somebody else. But truly, it's just nice to have that sense of community and to kind of help ease that tension and anxiety, that there are other people that are on a similar journey to you.
Yeah, definitely. Yep. So also EMDR, if those that haven't heard of that, I actually I'm terrible at remembering what exactly it stands for. But basically what it is it's like, again, kind of tapping. So if you see a therapist, they're actually trained therapists that do this sort of technique, and you will tap your either your legs, or you tap like an area on your chest, or they actually have like little handheld, like vibrating little hand, I forget what they're called, but yeah, then they vibrate like one at a time. And it basically stimulates certain sides of so your left or your right side of your brain, and it will basically create like new neural pathways in your brain. So like anybody that's gone through a traumatic experience, or if you're experiencing some sort of phobia such as this, that can really be very, very helpful. So I've had a lot of people have really good success with using EMDR. Yeah. Sorry, I can't remember what it stands for, but
it's eye movement desensitization and reprocessing therapy.
There you go. See, Allison's on it.
I think that's what it is. Yeah. But yeah, I think it's also great to assess where you're feeling the anxiety, the fear in your body. And the idea with EMDR too is to also try to help it feel less physically present.
Yeah, exactly. Yeah. So you, how I've actually done it before myself, and you do like think of that particular like stressful situation or phobia or trauma, whatever it is, but then you also go to like your happy place while you're doing it. And the other method they do use too is like a light that goes back and forth, and that's like the eye movements where that's where it, basically came from. So so yeah, really helpful with that. The other one is cognitive behavioral therapy. I don't know a whole lot about this. I haven't done this myself, but I know that, a lot of people have get a lot of good help from talking to a therapist using this sort of thing. I don't know, Allison, do you have any thoughts on this? Because I'm not too familiar with it.
The idea is to help kind of analyze like feelings, behavior, reactions, and try to kind of assess, like, is it going to be helpful for you? Is it realistic? How, I guess, does everything kind of play into each other? But you're kind of like an active participant with your therapist with trying to talk through these things, and they're trying to help you also discover those answers for yourself, because usually that's where I know I get the most power out of therapy, when I'm like, but aha, and it's something that like comes to me instead of someone tell, which sometimes you need to hear some advice or guidance or something anyway, but it's there's like a good partnership with that type of therapy.
Yeah, that makes sense. Cool.
Yeah.
And then watching positive birth videos. So this might be a little triggering for this sort of thing, but if it's kind of like a desensitization kind of method. So, just watching like, really good, if you're decide to want to have a home birth, you watch the positive home birth ones, you do the hospital ones, wherever you're deciding to give birth, you kind of watch those videos where it's a really positive, happy experience. That way you're, basically, again, kind of like reprogramming your brain around it.
Yeah.
So
I had a client that I recommended that, and she laughed at me. She was like, happy, positive. Yeah, right. And for her, it was very deeply rooted, where there was no way it was going to be a positive thing. It was something she would have to endure. And that's sometimes the way it feels.
Right.
So if it doesn't sound happy to you, if it doesn't sound possible that it could be something that would help, then it might help you with, not reframing, I guess, but more revisualizing what's going on, because a lot of times the fear is related to a certain scenario or visual that you're kind of playing over in your head. And if it's not like gonna help you, like, think about all the possible ways it could also go in a positive way, if anything, it also could just give you really great, like, tactile kind of tools to help you revisualize what it could be like. So if you're, for example, the fear of like losing control, for some people, the idea of being on their back or having too many people touch them, that type of thing might be constantly on their minds, or playing in their head. So if you're watching videos that are people like upright, where not a lot of people are touching you, or maybe there's really hardly anyone like in your bubble and in your space, that might feel slightly relieving, because you can get that visual rewritten maybe for how it could potentially be. So if you do have a specific scenario or something that you feel you can kind of pinpoint in your fear, and you're wondering about birth videos, don't hesitate to reach out, because we have a whole lot, whether they're like our own that our clients have given permission to share, or there are really excellent options on like YouTube or Vimeo. But if there's a specific scenario that you're struggling with, and obviously it's hard to like dive into the the whole world of like video options. You don't know what you're getting until you're watching it.
Right. Yeah.
So if it helps, we're happy to help like curate some options for you and send back something that would help with pinpointing what you're looking for without you having to like dig through all the videos to see what's going to possibly provide you comfort.
Yeah, absolutely. Yeah. Because trying to find the right video that's going to bring you that comfort can be a little overwhelming. So yeah, definitely reach out to us if you want us to send you stuff. Like watching undisturbed video, birth videos is really very helpful.
Yeah.
So yeah. And then also meditation is really great. So when those feelings are coming up, it doesn't have to be specific to birth. You can just get a calming, like fear releasing, meditation, or just, something to just calm your nervous system, whether it's just like a breath work exercise or something like that. It doesn't have to be anything crazy, 5 minutes. If you can get 5 minutes in, that's awesome. But that, meditation helps with so many different things, but it would definitely help with this too.
Yeah.
And then go ahead. Sorry.
I was just going to say, and like it kind of brings to mind hypnosis. Like for some people, they respond really well to hypnosis. And some people then use the hypnobirthing kind of curriculum in their pregnancy. Because for some people, if there are concerns about the medicalization of birth or the complications that could arise, sometimes the terminology that we use can feel a little bit by default like medical. So that's like a simple layer that could potentially be removed. Instead of saying contraction, saying surge or wave. Sometimes it feels like it just takes away some of the weight that word might have. So that's just something to think about. Yeah. Don't be afraid to hire a doula ahead of time too. You could
mention that.
You could
having doula is super helpful.
Yeah, you could be still trying to conceive. You could be not even at that point yet, and you're like, I just need to start lining things up. I think most of the clients that I've worked with who have tokophobia, I'm usually a prenatal, like pre-pregnancy conversation, and they've reached out prior, and we've established something. And I think there's a lot of reassurance to feeling prepared about who's on your team and how things might go, and what kinds of people are kind of more in your ear or in your bubble, because usually if you have fears, having people around you that are possibly contributing to that is usually not going to help. It's hard to be decisive about how to let certain things in and keep certain things out.
Yes. Yeah. Definitely finding the right birth team for you is really critical. Because you want people around you that are going to, just in general pregnancy, and birth, people should find that anyway, but especially with this sort of thing, really having the right birth team to like keep you in that safe place and just reassure you, and, just communicating to them what your needs are and them being able to meet those needs. Really important. So don't be afraid to like get what you want.
Right. And some providers see people with certain fears, but tokophobia or a very deep rooted fear that maybe is not diagnosed as tokophobia yet or ever, but it's very hard for some providers to fully understand the complexity of it.
Yeah.
And so, certain things that they might do by default could potentially be a triggering scenario or might contribute to some fear or anxiety. So whatever team you can get together that would make you feel really well supported to help, because really once a provider is more educated in what helps you or what would maybe potentially trigger you, they usually try to rise to the occasion. So they just don't have the outline and the understanding. So obviously it's helpful to rely on your partner and your doula to help communicate those things or to help you create your birth preferences list, or help kind of with a blurb upon arrival, like, okay, just so you're aware, like, we are here to give birth. This person has tokophobia. These are the things that we're most worried about. Here's how we really could use your help. And they will want to rise to the challenge, the occasion. And if for some reason, there's some struggle, that's why you rely on the people in the room, and the nurses can be really helpful too.
Yep.
Yeah. But you're definitely, you're definitely not alone.
No, definitely not. And one thing I do also want to say about this too is that I think hyper focusing on the tokophobia and that you have this fear can also create more fear. So, I think there's a place for acceptance around this too. It's just like, okay, I have this fear, and it's not really about like completely getting rid of it and it needs to go away. And it's this thing that like you have to get over.
Right.
Just, having some acceptance around this is how I'm feeling, just validating yourself, surrounding yourself with people that are going to validate you, but also support you, help you work through those moments is really important. When it comes to just fear and birth in general, just I really try to stress that to my clients. They have, fear of the pain or whatever it may be. It's like, okay, like it's okay to be afraid. It's totally fine. It's totally normal.
Right.
Like we all have it on some level. But yeah, just trying not to focus so much on like, I have to get rid of this, phobia. Right. This is terrible. I need to move past this.
Because truly it's unrealistic to say, I need to make this go away right now.
Right.
It's probably very much a part of you and your process so far that it's very hard to just assume it. There's got to be a way to like completely be rid of it. So we have to find ways to work with it.
Yes, exactly.
It's almost like that wonderful but annoying like kid at a party where you love them, yes, but all at the same time they're like bugging you, and you're like, I need you to go away, like I need you to stop, you're like you're stressing me out. However, when it comes to fear, sometimes you kind of have to be like, all right, come on Susie, come sit next to me,
sit next to me,
let's give you something to do, let's give me something to do, just distract ourselves. But yeah, there's kind of like those 4 steps that we've talked about for like freedom of fear. There's like just identify, just to even say I have tokophobia or I have fears, here's what they are. That's huge. It's
absolutely
huge.
Yeah,
because so many times we want to just shove it down,
and it just suffer in silence. Don't do that.
Right. Please don't.
Please
let it out.
And
then accept your feelings. Validate yourself. It's not bad to have these feelings, especially
not at all.
Especially if it's rooted in something else that you've experienced or someone close to you has experienced or whatever it might be. And then it's okay to, educate, prepare, like do all the things that can help you feel like logically you're ready or you've done what you can watching the videos or doing the tapping, whatever it might be. And then just release what you can or accept it also, like express it, release it, do something to put it on paper or sit the kid next to you, give it a name, call the name
definitely
something.
Giving it name. That's a really big one. I've heard of people doing that and it really helps a lot.
I think I had a client once where we were processing her previous traumatic birth and she was calling it the tornado.
Oh,
she was like, hey, tornado. And she would that was like a way that we could identify it without having to say, remember that fear or remember that scenario where blah, 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 blah. Like you just, it's a word, you name it. And it's kind of
separate from you. It isn't you, like giving it that name, like separates it from you. So you can kind of see it a little more clear. And, it's really an opportunity to like really get to know yourself and work through the things that you want to work through, become a better person, whatever it may be. It's a really good opportunity to like, have more healthier practices around whatever, if that's meditation or going to see a therapist or journaling more. Like it's kind of a gift in a way. I know that's hard to think of or say, but it's that kind of a gift, so in that sense that you can really like work on yourself, discover yourself a little bit more, dig deeper, uncover maybe some things that you didn't know about yourself. Like it's a really good opportunity for that. So
and I think it does help you to know what's in your control and what's unfortunately not.
Right.
We do like control, and it's hard to like figure out like what do we kind of like surrender to and what is it like that we have to really advocate for, because it doesn't have to go that way every time or something. I've had clients who they're struggling with, should I just schedule a cesarean and go be put under? Like I've had people who want that. They don't want to, you just
have the experience.
That would be better to them. That's not the easier path, but and the recovery is not easy. But it feels easier because of the potential trauma or triggers that are on your mind when anticipating the birth experience. But I think most of the time they don't end up following through with that, because most of the things I've seen, I guess, is when they are thinking about that, they're thinking, well, what's the best possible, like, healthy baby, healthy myself scenario? And so obviously recovery can be more challenging with that. But I think some people are wanting to also then do what their baby might need. And obviously both births are completely valid.
Yeah, of course.
But some people really feel like they want to give that vaginal birth experience to their baby. But there's also no shame. I've seen people who've really worked their heart out and they had everything lined up, and there was a pause to the labor, and they had to switch plans or do something different. And there is a weird, like, frustration with that. That's understandable.
Yeah, absolutely.
But so we can't obviously plan birth like we've talked about before, but anything you can do to make your birth preferences list, to try to understand birth better, sometimes that kind of can give you some freedom, because it's not this like weird thing in the closet, like a monster that's like hiding in the dark and you just don't want to look at it. You're giving yourself the opportunity to really come face to face with different scenarios and be like, okay, if I see this, this is what I want to do, or whatever it might be. And that there is power that's in your hands with that, because you're trying to, your knowledge is power, really.
Yeah, absolutely. Yep. Yeah. Great.
Yeah.
Oh, this was awesome. So,
thank you.
Yeah, thank you. All right. Was there anything else you wanted to add, or you think I think we've covered quite a bit?
Yeah. So. Please don't hesitate to reach out. This is a very challenging topic, and if you're like, I really need to talk through X, Y, and Z, or can you explain this method more, or anything, just let us know, because it's not easy to look into this or to try to find ways to overcome it or have it sit with you in a way that it's not impacting you the same way. Yeah. So we're here if you need anything.
Yeah, definitely. We are, for sure. All right. Well, I think this concludes our episode. So thank you so much for listening. And again, like Allison said, reach out if you have questions or anything like that. But thank you so much, and we'll catch you next time.
Thank you.
Bye.
Bye. That's it for this topic. Thanks for tuning in. Check out the show notes for any resources or links that we mentioned today. Make sure to subscribe and follow us on your preferred podcast platform, and also be sure to give us a review.
It really helps us grow and reach more people who could benefit from this info. Also, check us out on YouTube and visit our blog, where we have this podcast transcribed for you.
We'd love to connect over social media too, and we're just an email away if you have any questions or if you want to request a topic to be covered.
We hope this helps your mind, body, and soul in having the supported and holistic journey you are so deserving of. Embrace the power within you.